On this World Mental Health Day, significantly coinciding with the death of 10-10-2020, I take this privilege to share a few of my experience in respect of mental health. We must realize how our brain is. It has 100 billion neurons, and each neurons is having a protruding fibril-like dendrites amounting to 2,000 to 20,000. It is through these dendrites that the neurons communicate and interact with each other. So this interaction and communication can lead to a synaptic relationship of a trillion to a quadrillion connections. So this is how our brain functions, and we must realize that our brain is connected to each organ of our body. Unfortunately, we more often than not, we have tendency to take our brain for granted. We don't realize how it is keeping us well, healthy, and alive. We only come to realize when something goes wrong from our brain that leads to certain significant manifestation of behavioral aberration, and immediately we jump to the conclusion that he has gone crazy or she has gone mad or he's a lunatic, and the next step we take is to reject and to discriminate and to stigmatize them. So this is really a very challenging illness. If somebody were to have a little aberration in the brain that leads to suffering, it is most challenging. And that's why I used to think that of anguish in any illness, there is none greater than that of mental illness. And mental illness is also so, uh, it's not only the individual who suffers, the relatives and the family members and the community and the society can also be affected by an individual suffering. For example, in my experience, I had treated a case of what we call erotomania. It was a young lady and mother of two children falling in love with a man who, and the man do not know that she has fallen in love with him, and she would be literally following him everywhere, and if he raises his hands to make some gestures, she would interpret all those as signs of being loved by him. In fact, it so happened that she one day landed up in the very house of that man, and that caused a lot of complication in that man's family as well as in our own family. So one can understand how disturbing or how anguishing such an illness can be. There was another case these are a few spectacular cases that I remember. There was one case where the delusion of infidelity, where suspiciousness of a husband towards the wife had gone on to such an extent that he would not let her out of his sight, and in fact he started accompanying her for even going to her toilet needs. So of course they came to hospital by that time, and then he was also treated. There are some instances where a young lady, she had nihilistic delusion, you see. She totally believed that she's dead. But then she's coming to me for consultation, and we're discussing, and I'm trying to assure her that she's very much alive because she's eating, she's having bubbles, she's sleeping, and she's living with the family. But she strongly believes that she's dead. So these are a few extreme cases, and there were two such extreme cases of even violence. In fact, mentally ill persons are not more violent than normal persons, but people do have a feeling that all mentally ill persons are very violent, and therefore they should be rejected. They should not be allowed to live within the community or within the family. So there were two such instances where during an episode of mental illness, because of the auditory hallucination which she had, which they suffered, one of them threw a spear at his father, and which landed on the calf muscle of the leg. Another person, he assaulted his wife. Well, both the cases were treated, and after recovery, when I sent them back to their village, to their home, within few days, the whole village, it's almost like the whole village, because my children were saying that, how come the whole village has come to our house today? The whole village came with a petition, seeking my permission to let the patient stay in the mental hospital till he dies. Which I said, that would not be possible, because if I do that, I will be depriving another patient for treatment. So I explained to them that mental illness is a relapsing disorder. They have recovered, and if there is a relapse, he can always be treated. But during the period when he is well, and with medication and with family support, and with the community support, he is likely to do very well. So he could remain in the village and be a source of economic, even improve the economy of the family. But the village people were so insistent that I keep him in mental hospital. So I had to challenge them, and I told them, is your village a paradise that only good people will live in the village? So these are a few instances whereby I want to emphasize that mental illness is a medically defined illness, and when we take it into the medical domain, it is because we have treatment and cure is there and recovery is possible. But unfortunately, we have found, and that's the WHO, the World Health Organization, has found that actually only 20 to 30% avail such facilities. So 70 to 80% do not seek for any medical intervention or do not go for any treatment. So thereby we can imagine how we are depriving our needy patient for treatment which are possible. So I think it is very important, and in our Naga context, one thing I found is that, let me just use Nagamis here. I found a conflict in a Naga context between Morom and Sorom. Because of Sorom, there is less Morom to the mental patient, because they feel shy, or they feel dejected that they should be having a mental patient within their family member, or within their kids and kins, or within the community, or within the village. And therefore, in order to overcome that shame, they try to hide it. So here, in order to remove that stigma and discrimination, so that mental patients receive the due right as a patient with love and support, I think we have to increase Morom. If you increase Morom, Sorom will be reduced. Or in other way, if you increase love, definitely there will be less rejection and less stigmatization. And this is how we should be able to play a positive role for any of these needy patients who are going through such challenging times. And in fact, this year, the World Mental Health Day, the theme is mental health for all. It should be for all. It cannot be just localized to just 20 or 30% who seek for treatment. And if you want to make it mental health for all, definitely for the government, for the individual, and for all of us, we need to make a greater investment. We are not wanting to invest our time and energy for a mental patient as much as we do for a physically ill persons. But I think mentally ill persons need more of that investment in love and investment in terms of love and support and care. And so thereby we can make it a greater access towards availability of mental illness for everyone and for everywhere. With that, I would like to conclude my short talk. Thank you so much.